All right, everybody, it's 2:01 p.m. Eastern time, so we're going to go ahead and get the show on the road. Hope you're doing well. For those that just jumped on the call for the last couple minutes, my name is Phil Lamar. I'm one of the national marketing directors here with ACMG. Really excited that you are all on the call today. I think you're going to get a ton of value in what we're going to go over. No doubt about that. But before we get into the presentation with our team over at United, I want to introduce myself. Again, my name is Phil. I told you I'm a director here with ACMG. And for those that are not familiar with ACMG, maybe you've been partnering with us for a while. Maybe this is your first time you've ever been on an ACMG call. We are proud to say we're one of the biggest FMOs in the country. We have the honor, we have the pleasure of working with thousands of agents just like yourself. Whether you're a broker, an agent, you have people on your team, no matter what your business is like, we work with folks just like you in all 50 states and all over the country. And really our whole goal, our mission as an FMO is to really just serve you, to do whatever we can to help build your business and take that to the next level. And we specialize in doing that by providing the top products in the business, the top carriers, the top technology platforms, and of course, we also offer the top commission schedules in the biz. And so we're really excited for you to see this presentation today. Also want to give a quick shout out to my friend, the founder and CEO of ACMG is on the call with us, Rob Swander. And I'm going to pass it over to our team over at United Healthcare in just a second. But before I do that, I want to mention a couple things. If you've been in the insurance business for any time now, and you're in the health and life side, or heck, even if you're in the P&C side of the business, you know that now more than ever, people need health insurance. People need health insurance. I can't tell you how many people I've met over the last couple of years, especially since COVID, when people have been losing jobs, especially with the gig economy booming. People are leaving their comfy 9-to-5 jobs every day, starting their own business, becoming contractors, plumbers, electricians, real estate agents, whatever that business is. People are leaving their jobs or they lost it and they need health insurance. They need good quality health insurance. But we all know a big problem with that is, one, the marketplace is typically someone's go-to. If you can't get a tax credit or subsidy, it's extremely expensive. A lot of limited HMO networks, and oftentimes it's not the best fit for somebody. But what if I told you there was a excellent, robust solution to this problem? What if I told you that you can provide your clients, you can provide people, whether they're self-employed or they don't even like their health insurance through their job, that you could provide them with an excellent healthcare plan that has robust benefits, massive PPO networks, that's all still affordable at the same time? Well, that is the case. And so I'm so excited to introduce you guys to our team over at United Healthcare. United Healthcare has a amazing, robust portfolio of products for your clients. No matter what their need is, they've got the plug for you. So without further ado, I want to hand it over to our good friends and our team over at United Healthcare, and they're going to show you what they have to offer. So go ahead and take it away.
Thanks, Phil. Can you see my screen?
Yes, sir, David. We can see your screen. It says Health Protector Guard. We got it.
Perfect. And appreciate all the kind words. And we do. United Healthcare, we have, to our own fault, people say, hey, we love United Healthcare. There's too many options. And well, that's the thing. We're all about giving clients optionality. Sometimes we take that to the extreme, but we know, as you know, not every client fits the same. You can't put the same square ball in the round hole, right? Sometimes every client is different, and it is a puzzle piece. Because again, not everyone's situation is the same. Somebody might have be an individual. Somebody might have a family. People's incomes are different. So we like giving lots of options, but still robust coverage on top of that. So first, I'm going to start off with our Health Protector Guard plan. This plan is available in almost every state across the country. The reason California and Oregon are colored a little bit differently is because they do offer this Health Protector Guard plan. They're just on an older version of it. Still great plan, very similar benefits. So I'm going to show you here today, but just some small differences in that. But as you can see here, the majority of the country has this same plan. And so, as Phil was talking about with, people, changing jobs or maybe going self-employed, a lot of them are trying to save money and go with a higher deductible health insurance, which means, of course, is the higher out of pocket. And what a fixed indemnity plan does is it gives them benefits paid out per person for eligible medical expenses, regardless of the actual expense. Okay. In a lot of cases, if those of you work in the ACA model, obviously the word subsidy is an important word. And what a health protector guard or a fixed benefit plan can do is help subsidize someone's plan and help pay that out of pocket for them. So my government disclaimer slide here is this is not major medical coverage. It is health insurance. So let's don't let's don't put it too far. This is health insurance. Okay, it's just not considered major medical because it doesn't meet the minimum essential coverage guidelines. For example, we're not covering maternity. We're not covering pre-existing from day one. So there's some things, but it's giving you the things for your clients that the majority of them need. Of course, there's no open enrollment, right? So every day is open enrollment for our plans. And then our plans do go through medical underwriting. And so here's our process for underwriting. We do not pull an MIB. So this is the same for our underwriting on our other products like short-term and tri-term. We do not pull an MIB and we do not do a prescription check. When we underwrite a plan, we look at two things. We look at the application, obviously, how did they answer the questions? And then we look at internal claims. The nice thing about United Healthcare is we have a lot of members. And a lot, within the past 5 years, I think it's somewhere around 60% of all of Americans have had a United Healthcare policy, some way, some form, group, individual, Medicare, Medicaid. So we have access to a lot of claims. And so when we get an application, there are certain claim diagnosis codes that we can trigger for us. For example, someone with a heart condition, well, there's certain claim codes. Diabetes, there's certain claim codes. So we don't look in the cloud and everything else. We look at if a doctor has filed a claim with us, then we can catch that. And that's how we underwrite. So we originally offered Health Protector Guard back in 2016. This is back when the government limited the term for short term to 3 months. So we were looking for something that had a longer duration to help people keep their plan longer and be covered longer. Quite frankly, we fouled it off, okay, to use a baseball term. We hit a foul ball on our first Health Protector Guard because we kind of put things together, not last minute, but we were trying to develop a plan to fit everyone's needs. But immediately after that, we started doing surveys. So we surveyed customers, we surveyed brokers to find out what was working and what wasn't working. And a couple of years ago, we enhanced these plans. Now, again, it takes a while to file plans with the different state DOIs and such. So we've been working on this for a while, but all the changes we made to the plan were from the direct feedback of agents and customers. The first one is on our Health Protector Guard plan, we are using the United Healthcare Choice Plus network, which is the largest network in the country. Okay, this is our network. Obviously, we don't have a lease it from somebody else. It's United Healthcare Plan and United Healthcare Choice Plus network, which is going to give on average 56% discounts across the board. There's 6,500 hospitals across the country, 1.4 million providers. So when you look at the hospitals, Mayo Clinic, Cedars-Sinai, Johns Hopkins, MD Anderson, Cleveland Clinic. They're all in network. Okay. Now on Health Protector Guard, you can go anywhere. So you can go to any provider in the country, and your benefits don't change. The advantage of going to an in-network provider is you not only get your benefit, but you also get the network discounts. And I'm going to show you how that kind of works. So just to be clear, these are a couple of EOBs. Now, I am not violating any HIPAA laws here because these are my personal EOBs, and I'm happy to share them with everybody. My first name is James. That's why you'll see in the upper left-hand corner, it says patient name, James Maxwell. But so I had neck fusion surgery on October 26th of 2020. So I got a little spacer between my C4 and C5 and had my neck fused. First thing I want to point out, if you look at the top, so the claim on the left is for my surgeon and the facility, and the one on the right is the assistant surgeon. So I want to point out at the top, though, is how long it took the providers to file the claims. You can see the one on the left took almost 3 months to file it, but we processed it in 1 day. The claim on the right took them about the same amount of time to file it, but we processed the same day. And that's one thing that you don't see, right? When you're comparing plans and products from different carriers, it's easy to see a brochure and do a quote and see the price, right? I can say, okay, this plan's $180, this plan's $220. Well, similar deductibles, similar, let's go with a cheaper plan. And sometimes we are the least expensive plan. But what I want to point out, though, is the stuff that you don't see up front, and that's what we feel the most important part of an insurance carrier can do, and that's pay claims accurately and quickly. And we do that. Again, we process these claims in 1 day and the same day. But also look at the discounts. So these two bills combined is about $15,000. And just because I have United Healthcare, I have a $12,000 discount. Okay, so it's not because I'm an employee, it's not because I'm on a group plan. That is the United Healthcare Choice Network. Okay, now, because this happened late in the year 2020, I had met my deductible on my group plan, so I only had to pay 20% of the bill. But still, you can see this bill is 15 grand, discounted by 12, just because of United Healthcare having that coverage. So here's my anesthesiologist. You can see they filed their claim a little bit quicker. They filed it in less than a month at the very top. And you'll see it took us 6 days to process this claim. Still very quickly. I will note, though, if you look back in your calendar of 2020, there was a weekend in there. So we actually processed this claim in 4 business days. Again, very quickly. So my total bill for my neck fusion was $18,000. My discount, the network discounts, just because I'm using United Healthcare, was $13,000, which means I would have owed $49.96. Now, like I said, I was in my co-insurance. I didn't have to pay that, but I'm going to circle back with this Health Protector Guard plan and how this would have worked. So another thing we did is we increased the wellness benefits and we reduced the waiting period. So now there's only a 30-day waiting period for your wellness benefits to kick in. And I use this as a selling point with my agents, okay? I tell agents, hey, when you're talking to a customer, and you're trying to show them why this plan will benefit them, what I would typically do is ask the customer, hey, when's the last time you went to the doctor for your annual checkup? Typically, the answer is going to be, I don't know, or a long time ago. So what I like to do before the end of that call is, once they know what they're, hey, this is the plan I like, this is the plan that fits my budget and fits my needs, then, all right, Mr. Customer, why don't we do this? Your wellness benefits kick in 30 days after your effective date. So we're going to write this policy with a, let's say, effective date of tomorrow. So we're going to have a June 23rd effective date, which means July 23rd, you could do your wellness benefit. So let's go ahead and schedule that. What doctor is that? Let's look him up in the network. Let's go ahead and call and make that appointment for them. So number one, it lets the agent, lets the client know the agent cares. Number two is we want them to use this plan. Okay, what we found is if clients use Health Protector Guard within the first 3 months of the policy, they tend to keep it longer because they see the plan working. They see how fast their claims are being paid. They see how fast they're getting their money. They see that and they're like, you know what, this is worth it. So we want clients to use their plan. So again, I always advise set that wellness visit up, maybe 45 days after the effective date to give it a little bit of leeway. But it also adds buy-in for the client as well, knowing that you care and you're going to help them set that appointment up. We also added more office visits on all the lower price plans. And then we have prescription benefits on all the plans. And then we focus on, we talked about, I mentioned earlier how if a client used the plan the first 3 months, they tend to keep it longer. So another thing we've done is we built in some retention type benefits. So over time, their benefits will increase for mammograms, pap smears, and PSAs, as well as they'll get additional doctor visits and additional prescription benefits after the first year. So again, to entice them to keep the plan longer, which is best for them. We improved our surgery schedule, which I'll go over. Refined our lab, x-ray, diagnostic benefits. We have a hospital admission benefit. So as soon as they're admitted to the hospital, they get a benefit. Increased our ER benefit, and then included our telemedicine. So we have a number of different telemedicine products. So the Healthiest You benefit, we included in Health Protector Guard, which gives them 24 hours a day, 7 days a week, unlimited, at no additional cost. So there's no additional copay or anything for medical visits. Okay, there is a psychiatric and a dermatology benefit in there as well, but they do have to pay for those if they use them. But just for like to use this as a doctor visit or urgent care, your home and when a kid is sick, just use this telemedicine benefit, and they won't have to pay anything out of pocket for it. So with Health Protector Guard, there's lots of options, okay? So the way I like to start it with my clients is saying, okay, first thing is, how much would you like as far as a benefit for each day you're in the hospital? Let's start with that. Is it $1,000 a day up to $5,000 a day? Okay, and that's how much money they're going to get reimbursed for being in the hospital, unlimited days. Okay, so if someone's in the hospital for 6 months, they're going to get 180 times whatever that benefit is, $1,000 to $5,000. Now, if they're in the ICU, they get an additional benefit of $1,000 up to $5,000, and that benefit is 31 days per calendar year. Okay, so again, if they're in the ICU, then they're able to double dip these benefits. I mentioned the hospital admission benefit. So as soon as they're admitted to the hospital, boom, $1,000, $2,000, $3,000, or $5,000. So you think about this. If someone's admitted to the hospital, and let's say they're on that select plan, then they're getting $2,000 for their hospital admission, plus they're getting $2,000 for that first day of confinement. So $4,000 in that first day if they choose that select plan. Now, another change we made is that hospital confinement is for every 24-hour period they're in the hospital. So I know a lot of hospitals will admit somebody, but they're admitted under the observation label, and they can do that for 72 hours. Okay, we will still pay the benefit for those 72 hours. So if they admit somebody under observation for 3 days, your client is still going to get 3 days of that hospital confinement benefit. Emergency room, they get 1 visit per year. And then when I talk about a year, these benefits reset every January 1st. So if somebody buys a plan in April or somebody buys a plan in October, they still get the 1 visit ER, they still get their 1 hospital admission benefit, their 31 days of ICU and such, okay? Now remember, hospital confinement is unlimited days, but every January, all these benefits reset. Ambulance, they get 2 trips and reimburse either $500 up to $1,000 or $5,000 for air. Surgeries, I'll cover here in a second. But then for outpatient facility, they can have 2 or 3 outpatient surgeries, and there's their reimbursement for that. And then for labs and tests, outpatient labs, $30 to $75. X-rays, another diagnostic like ultrasound, EKGs, they're getting the $30 to $100. And then for tier 2 imaging, MRI, CAT scans, PET scans, $250 to $500. And you'll see there they get 4 or 5 tests again per calendar year. So we don't tell somebody, hey, you're allowed 1 X-ray and 1 EKG. We just say you're allowed 4 or 5, depending which plan you choose. And if you want to have 4 MRIs, that's fine. If you need 4 X-rays, that's fine as well. So the combination of those. Chemotherapy, we have both oral and then outpatient. So oral, they get $1,000 a month for 3 months. And then for outpatient, they get $1,000 up to $2,000 reimbursement. And then they get 20 to 40 treatments. So, most of the time if someone's getting chemotherapy, they'll have 3 or 4 days of treatment and then take a few weeks off. So that's why, those 20 days, you think about it, that's, probably it's here. If say you do 3 every 3 weeks, that's around 15 weeks of treatment. And of course, then come January, all the benefits reset. Now I mentioned about retention. So one thing we did was your hospital confinement. It doubles after the first year if you're admitted for an accident. Okay, so if you're admitted to an accident to the hospital, your benefit doubles after year 2. So you can see the choice plan goes from 1,000 to 2,000, the select from 2 to 4, and so forth. Now, they increase on the first of the year if they've had a plan for longer than 6 months. Okay, so what that means is we're not going to reward somebody who buys a plan in October and double their hospital benefit in a couple of months. So we say you must have the plan for at least 6 months. So anybody who has an effective date of prior to July 1st, so everyone has an effective date come January 1st through the end of this month, then come January, they'll get their double benefits. Anybody who buys a plan with an effective date of July 1st through the end of the year, they just have to wait 1 more January. So they buy a plan now, then come January of 2024, that's when their benefits would double for the hospital confinement for accident. Surgery schedule, we made adjustments to this as well. So surgeries have different tiers, and so based on the severity of it, I wish I could say, well, every appendix is going to be a certain tier, but it depends on it. Is it something like, hey, yeah, we need to take your appendix out next week, or is it your appendix just burst and you need to have surgery, or what? So depending on the severity, it could fall on different levels. Now, again, I told you I had neck fusion surgery, so that's a tier 4 surgery. Okay, so that's where my level would be. And then you also get assistant surgeon and anesthesiologist benefits as well. So what that means is, in my case, my surgery, if I had the choice plan, I would have received $2,500 plus another $500 for the assistant surgeon, And then 30% of that $2,500, so what's that, $750, for the anesthesiologist. So again, when I circle back to my own claim, my total bill was $18,039. Just because I have United Healthcare health insurance, I got a $13,000 discount. So I would have owed $49.96. So again, if I would have chosen that choice plan, which is the least expensive plan, I would have got $2,500 for my surgeon, $500 for the assistant, $750 for an anesthesiologist, and then $1,000 for this facility. So my Health Protector Guard plan would have paid $4,700, which means I would have owed $296. So that shows you how the plan works and how it can help your customers. Now, these plans do have a $2 million maximum benefit per year and $5 million for the lifetime. We've been doing health insurance, well, at least my division has been doing health insurance for almost 80 years. We have a pretty good grasp on claims and how much people use. If we thought people were going to hit these maximum benefits, we would change them. But we're very safe in these maximum benefits for the plan. So once you figure out the hospital and the lab benefits, then you want to go into what we call the works section. That's for wellness, office visits, and prescription drugs. So there's 3 different works options, and I'll tie this in together. So don't get too over the top here. I'm gonna tie all this in together. So remember, you had 4 different options for your hospital confinement, and now there's 3 different options for your works. So does somebody want reimbursed $80 for a doctor visit, $100 or $125? Does somebody want $25 for their wellness labs, or $50 or $100? So this is where you choose what kind of works you want added on to your hospital benefit. Okay, as you can see there, mammograms are covered, bone density is covered on one of them, colonoscopy is covered on all of them for preventive age 50 or over, and then doctor visits. So you get 4, 5, or 6 doctor visits, depending on which option you choose. And you get reimbursed $80 to $125 for a regular doctor visit. You get reimbursed $100 up to $150 for a specialist or an urgent care. And then again, $200 to $250 if you do an office visit with an in-office surgery instead of going to a specialist. And what we tell somebody is they get 4, 5, or 6 visits. They could do all specialists, all primaries, all urgent cares. It doesn't matter. Remember, they also get unlimited telemedicine visits for no extra charge. So they could have a limited number of those. So when you tie that into this, as you can see, it's a real robust plan. Chiropractic or physical occupational therapies, you can see it's not covered on the Works 1, but they do get 10 visits reimbursements for the Works 2 and Works 3. And then prescription drugs, so these are not co-pays, these are what they get reimbursed. So they get reimbursed $40 or $60 for brand names, and then for generics, they get reimbursed either $10 or $20. And then they get 12, 15, or 20 reimbursements for their prescriptions per year. Okay, so the way prescription works is you go, you'll get a discount using your card, or if you want to use GoodRx or whatever else, perfectly fine. Pay for your prescription, and then you'll turn the receipt in, and then we'll reimburse the client based on if it's a brand name or generic drug, how much they get reimbursed. So as long as a client goes to an in-network provider, prescription is the only thing they really need to file, because if they go in-network, then the provider will file the claim for the hospital, for the doctor visit, all the tests. Okay, so the prescriptions is really the only thing that the client has to file their own claims on, which there's just a claim form. They fill it out, submit a copy of the prescription, and the receipt, and then we reimburse them the money. So another thing we do to help persistency is those doctor visits. Again, after the first year, come January, as long as you had it for 6 months, instead of 4 visits, you get 6. Instead of 5, you get 7, and so forth. So as you can see there, someone can choose that choice plan, which is the least expensive plan. And remember, their hospital confinement benefit for accidents doubles to $2,000 in year 2, right? Their doctor visits, now they get 6 visits per year. And then prescriptions, they go up to 17 prescriptions. So again, lots of things we're trying to do to help entice customers to keep their plan, as long as it's the best thing for them. I mentioned earlier, wellness has a 30-day waiting period. Kids on the plan, they get reimbursed for immunizations and flu shots, or also allergy treatments. Adults get reimbursed for a flu shot, and then also a pap smear. And then for men, they get reimbursed for a PSA test after the age of 40. All right, so I'm gonna go touch a couple of the questions here. Under the hospitalization, if admitted for an accident in year 2, coverage is doubled. Was it for illness? So the coverage for the illness hospital admission hospital benefit stays the same. So it stays where it was, but it doubles if you're in the hospital for an accident. Okay. Issuing age, give me 1 second. I'll get to that here in a second. Underwriting, I did cover that earlier, but I'll talk to you again. So on underwriting, the way we don't pull an MIB, we don't do a prescription check. We look at United Healthcare claims internally only. So, if someone says, I know it's gonna be hard to believe, but some people forget that they had a heart attack 3 years ago. Okay. I've seen it happen. Someone clean sheeted the application that they're perfectly healthy, but they just happen to have a United Healthcare group policy 3 years ago in which they had a heart attack. So we caught that one. Okay. But that's all we do. We don't pull an MIB. We don't do a script check. We don't have access to anyone's medical records. I think that's a misnomer that a lot of people think, well, you're United Healthcare, you have access to medical records. No, we don't. We have access to claims. Now, we can order medical records from certain providers, but that's not something that's just out there for us to have access to, okay? Next one is the RX benefit paid for pre-existing fills within the first year coverage. Okay, so in the first year, pre-X is not covered. However, it's hard for us to determine on prescriptions of what's pre-X and what's not. So what I tell clients is, according to the policy, United Healthcare does not have to reimburse you for your pre-existing medications. However, if it happens, great. Kudos to them, okay? But again, we shouldn't, but sometimes it does happen. Caroline Smith's asking, how do we contract? You know what? Rob Swander and Phil Lamar would be happy to help you guys get contracted on here. So, and then Porter's question, what United Healthcare plans do applicants have to be on? They don't have to be on anything other than California. In California, you must have an MEC plan, but for any other state, Health Protector Guard, you can have a standalone, which we don't recommend, but you can pair it up with an ACA plan, with our short-term plan, our tri-term plan. You can pair it up with anything you want. And yes, Tom, they can be on ACA, and this can act as an indemnity along with it. Absolutely, yes. All right, so I'm gonna go back to the presentation and I'll come back to some questions, okay? So this is a screenshot of our quoting portal. As you can see here at the bottom, I told you we have lots of options. So like this HPG choice 1, choice 2, choice 3, that means that's our Health Protector Guard choice plan with either the Works 1, Works 2, or Works 3, and so forth. So you would just check those boxes. Again, you could pair it up with a short-term plan or a tri-term plan if you would like to. And so then I did a quote. Okay, so this is a 35-year-old male in Arizona. I chose Arizona because that was one of our first states we launched. Okay, and so I did a broad range here. So again, this $62 premium, that's that choice plan with so $1,000 hospital benefit with the $80 reimbursement for doctor visits, and all the way up to the most expensive plan on the far right hand side for $161. That's the premier plan. So $5,000 a day benefit for hospitals, and then you're getting 125 for doctor visits. But look at the difference in premium there. That's $100. So again, we give people options. Some people say, you know what, I'd rather pay this person, I'd rather pay the $161. That's, again, individual male, 35 years old on this quote. But they might say, hey, I went to 161. That gives me $5,000 a day for in a hospital. So if I'm in a hospital 4 days, I get 20 grand. Fine. Somebody else might say, you know what, give me the $1,000 a day. So if I'm in there, 5 days, I'm getting $5,000. But now I have an extra $100 of wallet space to work with. Okay, so maybe go with that $1,000 plan, the choice plan, and maybe they could afford the 160, but you can do the $62 plan, add on a critical illness, add on a separate accident plan, and just build that up where maybe they don't have it out of pocket at all. Because maybe you have an accident plan on there that if have an accident, maybe they get 30 grand, or they have a heart attack, they get 50,000. Well, now they don't have any out of pocket. So obviously lots of options to work with here. Payment due date, so what we do is you pay either EFT or credit card, okay? And we don't draft the first premium until the effective date. And we do a prorated version. So what that means is, let's say somebody bought that $62 a month plan. Well, tomorrow is what's tomorrow? 23rd of June. So we basically have 7 days left. So if somebody bought a plan with a June 23rd effective date, we're not going to draft that full $62. We're going to just draft 7 days worth. Okay, so basically that's $2 a day, right? Because 30 days in June. So that plan's costing basically $2 a day. So that first premium, if their effective date was the 23rd of June, we would draft like 14, 16 bucks. Okay. Then in July, then we draft the full month's premium. So just so your clients know, if they say, well, hang on here, I thought my premium was X, United Healthcare drafted Y the first month, that's why. Okay. You can choose any effective date you want, including the next day, and you can go out up to 60 days. So, if someone says, hey, I'm losing coverage August 1st, you could do that, so have a plan there. So remember, these plans are guaranteed renewable. So once they go through underwriting, the only way their plan would end is if they turn 65 or they quit paying their premium. Benefits are per person. We do cover pre-existing conditions after 12 months. They can use any doctor or hospital they want to, but again, if they use a United Healthcare Choice Plus provider, then they also get a network discount on top of that. And we don't coordinate benefits, which is a great thing. So let's say you paired this with, someone asked a question earlier, can you pair this with an ACA plan? Yeah. And so let's say, if it's an individual, what's their max out of pocket on ACA plan? Like 70, under 8 grand or something like that, right? Well, what happens if, they're on a choice plan? What if they're on a select plan that pays them $2,000 a day and they're in there 5 days? Well, they're getting 10 grand at least, right? They're going to get more than that probably depending on what's all done in the hospital, but they're getting 10 grand. But if their ACA plan, the max out of pocket, let's say $8,000, then they're getting 2 grand back in their pocket. And then let's say they're in a hospital again. Well, that's just more money that they're getting because they've met their out of pocket for their other plan, right? So the fact that we don't coordinate benefits, that's a great thing for your clients. To get these plans, to answer your question, so you have to be at least 19 years old, and then the maximum you can be is 64. You can keep it to the age of 65. Now, we do allow kids on the plan, but just not by themselves. So kids have to be on the plans with their parents. But again, you can have, mom, dad, and a 10-year-old and a 5-year-old on the plan. That's perfectly fine. Okay, so that is Health Protector Guard. Okay, so that's our fixed benefit plan. We also have 2 additional fixed benefit plans that are guaranteed issued. Okay, so remember, underwriting the first one, we're looking at claims. And so that's how we underwrite. On the guaranteed issue plans, I know it's redundant, but it's guaranteed issued. All right, so they could had a heart attack last year. They could have cancer currently, and it'll still be issued. Now, it's not going to pay for pre-existing conditions until after 12 months, but they will get issued the plan. So again, no medical underwriting, regardless of their health conditions. It's guaranteed issue, and we cover pre-existing conditions after 12 months. It's going to do the same thing like Health Protector Guard did, pay them cash benefits for covered expenses. So on the hospital guard guaranteed issue, there's 3 plans, A, B, and C, which I'll cover here in a second. Now on that plan, there's no network. So that plan's a little bit cheaper because there's no network involved. Then the hospital safeguard guaranteed issue, it's a little more, it's also more robust coverage, which I'll cover here, but that one uses the multi-plan network. Okay, so again, it works the same way as Health Protector Guard, right? The provider files the claim. We'll pay the provider what the benefit is. If there's anything left over, that money goes to the client. Okay, so for example, the doctor visits. Okay, like one of the plans had $100 benefit for a doctor visit. Well, if I go to the doctor and after the repricing amount, let's say the doctor bills $70. Well, then what we'll do is we'll send the doctor $70 to cover the bill. Well, you still have a $30 left over, Mr. Customer. We'll send the customer $30. So they don't lose out on benefits. We're going to pay the provider what they're owed. And if there's anything left over from the benefit, we cut a check to that to the customer. So the hospital guard plan, A, B, and C, you'll see there it gets $500 up to $1,000 a day. But unlike Health Protector Guard, it's not unlimited days. It's maximum of 31 days per confinement. Okay, ICU, same thing. You do get a hospital admission benefit. Doctor visits, you can see it's not available on the plan A, but on plan B and C, they do get reimbursed for doctor visits or urgent cares, and they get 4 visits per year. And then there's an accidental loss of life, limb, or sight rider, where they can get $20,000 for primary or spouse, and then $5,000 for the dependents. So again, on the hospital guard, again, I call it Health Protector Guard Light or Diet Health Protector Guard, okay? So just a little bit lower benefits, not unlimited benefits like Health Protector Guard has on some things, but they can use any provider, same benefits, no deductible. But in this case, since there's not a network, the client has to file the claims. Okay, obviously the provider won't file claims because there's no network on that plan. Now on the safeguard plan, the hospital safeguard guaranteed issue, as you can see, there's 4 different plans. They're getting near 500, 750, and then you flip here, or $1,000 or $2,000 for hospital confinement. Okay, same thing, 31 days. They get their ICU coverage, hospital admission. They get an inpatient surgery benefit, anesthesiologist, ER, ambulance. Same thing here on the plan 1000 and plan 2000. It's just obviously the dollar amounts are different than the plan 500 and 750. For outpatient services, they get reimbursements for doctor visits. So you can see there it ranges from 4 to 6 visits per calendar year. For non-preventive testing, they get reimbursed for their labs, their x-rays, MRI, CAT scans, PET scans, just like on Health Protector Guard, just lower amounts, okay? Because remember, this one's guaranteed issue. So if someone can go through underwriting, then obviously it's probably best go through Health Protector Guard, okay? But if someone has a condition that would cause them to get declined, then go guaranteed issue. The safeguard has wellness benefits as well, and then also your accidental loss of life, limb, or sight. Now, again, this one uses a multi-plan network, 4,600 hospitals, roughly 900,000 providers nationwide. Again, if they use an in-network provider, then they get the network discount on top of their benefits. So the client will get an ID card in the mail, just like on Health Protector Card, they do the same thing there too. So they get an ID card, they show their ID card, and in that way, the provider can file the claim. They also get prescription discounts through Optum Perks. Optum is a company that United Healthcare owns as well. And then the Health Issue telemedicine is not included like it is on Health Protector Guard, but you can definitely add it. The telemedicine Health Issue is $20 a month premium for the entire policy. Eligibility, just like on Health Protector Guard, I'm sorry, I said 19, should be 18 years old up to age 64, and renewable up until the primary insured and spouse have reached 65 years of age. Okay, so no, they cannot keep it once they're past 65, even if they're working. Okay, the maximum age is 65 for them to keep the plan. And then also, they can't have 2 different fixed benefit plans. So they can't have like Health Protector Guard and then add on the guaranteed issue plan as well. Okay. So in summary, for the guaranteed issue plans, there's no medical underwriting. You can write it standalone or bundle it with other products. It is a fixed benefit plan. There's plenty of flexibility on all the plans, and then also a bonus. So right now we've got a bonus running. If you don't know about it, obviously reach out to Phil or Rob at ACMG, and they can show you how to register for it. Obviously get you appointed with us if you're not already. But on this bonus, it runs through the end of July. You just have to register for it. And then if you write 10 policies, okay, combination, Health Protector Guard, the guaranteed issue plans I spoke about, you know, as you can see here, we have accident plans, critical illness, dental, standalone healthy issue, and then our other telemedicine product, new benefits. So as long as you write 10 combination, then you'll start earning money back to your first policy. So if you write 10 Health Protector Guards, right there, that earns you $700. Okay, let's say you add on a dental and a critical illness on every policy. Well, that's an extra 50 bucks times 10. So there's another 500. So now you're at $1,200 bonus just for helping your clients. and with these plans. Okay. So again, we all have customers, and it's like, unfortunately, we can't help you. Well, now you can. Okay. Again, with guaranteed issue plans, now you can help out anybody. Yes, the Affordable Care Act plans is a great source and a great avenue for people based on their income and their health conditions. But if they don't want to go that avenue, just because they're uninsurable, typically, you can now get them a guaranteed issue plan. And that's all I have for today. I appreciate everyone's time. We got about 9 minutes to spare here. So if there's any, I'll stay on here until Phil and Rob kick me off, or until the top of the hour if there's any more questions.
Thank you, David. Great presentation. I'm sure everyone got a lot of value out of that. So I just want to mention a couple things real quick. If everyone opens up the chat, you'll see there, Rob and I threw in the chat instructions on all contracting. So it's really simple. We made it easy. You just need to email agentservices@acmgsales.com. That's all you have to do. We'll help you get contracted. We'll send you all commission schedules if you have any general questions. But David, did you see any other additional questions in there in the chat?
The only thing I saw, there was a question about New York, and unfortunately, these plans are not in the upper Northeast.
David, Philip, this is Rob. There's some questions coming in. They're direct messaging me. We've got two here from Porter Guthrie. One question is, how long can one keep these plans?
Sure. Once they get the plan, they can keep it until age 65, or they quit paying their premium. So we will not cancel them based on any kind of condition they might get during the plan, but they can keep it to age 65.
Got it. David, do you have the state availability chart available? Some members are asking which states are they not in. I think we showed that earlier. If you can pull that slide up again, that'd be great. If not,
Yep.
I can email you guys later.
Yeah, I'm trying to flip. Let me do it this way.
While we're pulling that up, another question from Porter. I think we covered this, but maybe we could go over it again in regards to tobacco users.
Yeah, tobacco users are acceptable. There's a question on there if they're a tobacco user, so there might be a little bit of rate up for that.
Question.
Okay, so I do have the state grid up. So again, all the states in green and blue, we have Health Protector Guard in. The states in gray, we do not have Health Protector Guard or the guaranteed issue plans.
Perfect. Rob, did you get any other DM questions, or is it just those two?
Yeah, that was it. There was one more question that came in regards to, is it e-contracting? Yes, it is e-contracting.
Yeah, and again, everybody, just to make it really simple, contracting is a very simple process. It doesn't take much work at all. We made it really easy. You just have to email us at agentservices@acmgsales.com. Again, that's agentservices@acmgsales.com. We'll make sure we get you contracted. We'll get you the commission schedules. We'll take care of all that. So we make it simple. So I'll throw that in the chat real quick as well.
Guys, I just want to add also that, there are appointment fees for each state. Many agents are licensed in multiple states, but ACMG has special arrangement with United Healthcare. If you're a new agent, we cover your first year appointment fees. So that's a big plus. Also, agents that are contracted with ACMG, we do offer a 9-month advance on all products, which is a big plus if you need cash flow for marketing.
Yeah, and that's a great point, everyone. What Rob said, that's something that ACMG offers that most FMOs don't offer. Is we are going to help cover a lot of those first year appointment fees. If you have license in multiple states, that adds up, and we're going to go ahead and take that for you. I did see another question there, someone asking about 65 and up. United Healthcare does offer Medicare products. If you have any questions about that, just email us at agentservices@acmgsales.com. This call is focusing on 65 as under 65. So all these products are under 65, but ACMG does have many, many options for 65 and up. And if you do have questions about that, specifically with United Healthcare's 65 and up offerings, just email us at agentservices@acmgsales.com. We'll help you out with that.
And Phil, I did see a question, like if someone's already contracted with us, based on your situation, it's very, very possible for you to transfer. So it just kind of depends on if you're an independent agent. It's an easy thing to transfer to be under ACMG. If you're under a different upline, it's still possible. There just might be another avenue way to take, but you can definitely transfer under ACMG given the right circumstance.
Perfect. Thank you, David. We appreciate you clarifying that. Someone else just asked again about commissions. For remember team, for all commissions, if you want to know how that works, what those levels are, we do offer FMO levels. We have MGA, GA levels, depending on what that looks like. So just communicate that with us. If you have a team of 5, 10, 15, 100 agents, doesn't matter. We do have some production requirements for MGA contracts and GA contracts. But again, if you have a team, just email us. We'll make sure we set you up with the appropriate contract. But if you do have any questions, how often are you getting paid? What is the frequency? Is it coming from the carrier? Is it coming from the MGA? Whatever that is, just email us at agentservices@acmgsales.com, and we can make sure we help you out with that. So just to make it really simple there. Looking through here, I think that might be all the questions I see right now. So David, do you have any final thoughts, anything to close us out, or any advice that you would give us as independent agents before we end the call today?
You know, I think for the agents, you know, I don't care if you've been new to the industry or you've been doing it for a long time, you know, with the tools that United Healthcare and ACMG is giving you, you really can help out every customer you meet. Okay.
Right.
Between our suite of portfolio, between ACA and then other products that ACMG might have outside of United Healthcare, you really can help every single person you walk up to.
It's so true. That's the nice thing about United Healthcare is it really is a one-stop shop for insurance benefits for people. That's what we love about it. We have a great partnership with United Healthcare, and we hear all the time success stories from our agents that are helping clients every single day get quality insurance at an affordable price. So if this is something obviously that you don't have in your portfolio yet, I strongly encourage everybody, email us at agentservices@acmgsales.com, get contracted. You're going to want to have United Healthcare in your portfolio for many reasons. One, you can help your clients. But secondly, I can tell you your competition down the street, the broker down the street, they're contracted with United Healthcare and they're selling it. And so just to stay up with what's going on in our industry, you're going to want to have United Healthcare in the back pocket for any situation. And again, whatever it is, supplemental, dental, vision, health, they've got it ready to roll for you. So I'm looking here. Awesome. David, we appreciate your time. Thank you so much. Amazing presentation. Great job. And team, thank you for taking time out of your schedule. We had a great call with you. We're looking forward to seeing you next time. We hope you have a successful week. Go out and get it. And we will see you all next time.